Hello, I'm Matthew Weinstock, Managing Editor of Modern Healthcare, and thanks for tuning in to the latest edition of the Checkup. So, as the industry inches its way towards new payment models and away from fee for service, we all know it's incumbent on payers and providers to find new ways of partnering and collaborating around patient care. I'm really pleased today to be joined by Jeb Dunkelberger. He's CEO of Sutter Health Aetna. That's a joint venture between the large Northern California health system and the CVS owned insurance company. And prior to joining that enterprise, Jeb came from a couple of healthcare startups in Silicon Valley. And before that was doing value-based models at Highmark Health, a Blue Cross Blue Shield plan out east. Jeb, thanks so much for being with us today. We really appreciate it.
Hey, Matthew, thanks for having me.
Absolutely. So as I said, I want to start first. As I said at the outset, you joined Sutter Health Aetna at the end of 2020. Obviously, an interesting time for anybody to start a new venture. Just walk us through what that experience has been like for you now that you're 6-7 months onto the job.
Well, hopefully I'm not as awkward in my, interview here as I was during my virtual onboarding with Sutter Health Aetna. That's the thing is I onboarded it in this virtual environment. I can tell you that is very hard to do. So for any organization that's thinking about a hybrid model going forward, as you're onboarding people, the cultural emulsion that happens from an in-person onboarding can be completely lost. And so that's probably something I'd call out. And then, I think in the first few months of being part of this joint venture, what I've come to realize is that it's hard work, and I oftentimes have called by people saying, oh, well, is it like Haven? What's going on? What's different? What's the same? I'll tell you this, it takes a gritty leader who's immersed in much in the strategy and the operations as they are in the internal selling as much as the external selling. So it's been fun for the first few months, but we got a lot of ground ahead of us.
So as you think about the difference, you said you get some of these questions. So how does it compare to, say, an experience at Highmark where you're working with a bunch of different providers and here you're centrally focused on Sutter Health products?
Yeah, I think that when you're thinking about what we have in Northern California, the scope is obviously much more limited. That being said, where it's very similar to like my days at Highmark is the fact that first off, you got blue on blue competition in our backyard with Blue Shield and Anthem. We're in Kaiser Permanente's backyard as well. So if you're looking for like a bastion of innovation with a lot of competition, look no further than Northern California. So for that, it feels a lot like Highmark and being in the backyard with UPMC and a lot of the tension that was between those two integrated delivery and financing systems.
And so now that you're, a few months into the role, I know one of the things you're looking at is growth and expansion of the network a little bit. So talk about how you evaluate what you want to do with Sutter Health Aetna. What are some of your strategic priorities?
Yeah, coming out of Silicon Valley, I obviously understand that there is this, wild kind of frenzy right now around point solutions. And so for me, I haven't even been focusing on that nearly as much as what really got my attention around growth has been the American Rescue Plan. Right. And what was packaged within that around the new provisions of expanding coverage and transparency. And so as I think a lot of folks know, this really complements the hospital price transparency rule, the transparency and coverage rule that's coming out in 22. And that's all really what I feel like is the beginning of a true investment in consumerism. And with that, I think that's also, complemented the fact that employers have had to feel a tremendous weight providing health insurance benefits during this, economic fallout during the pandemic, which has really kind of opened up this, Pandora's box for payers, where we have to understand how to evolve quickly and how to prove our relevancy in the value equation. So for me, I have not been focused so much on just the clinical programs. That's where I love the fact that we're partnered with Sutter Health. And they are already well ahead of many other provider organizations and payers. But where I focus now is what does the consumer need, right? What does the patient need? What does the employer need? And really breaking down the silos and transparency rules that are going to allow folks to feel more comfortable moving into the future in this post-pandemic world.
And so are there areas in specific that you're looking at to break down some of that transparency, those transparency walls that are up right now? Are there a couple examples you could provide?
Yeah, I think that the first thing is like freeing the data, right? So as much as we can, going in and opening that data and making it so that others can actually see it and then make decisions based on it. I think it's fine that the rule says, machine readable file, but any average patient, it doesn't have a machine ready readable format in their head. So you have to make it at the point of care, at the point of service. We have found that many providers, they are just products of the system as a whole. And so it's not like they are looking for their referral management to lead to that highest cost site of care. It just happens sometimes to be that way. And so we as a payer, where we have that data and that information, we have to empower our providers to be able to do better on behalf of the patient. So I say consumerism in quotes. I think we still have a ways to go to actually allow folks in America to actually act as consumers of healthcare.
Obviously, Sutter Health, separate of the joint venture, Sutter's had some problems with transparency and pricing in California. Does that impact any of your thinking at all?
No, I think that, when I look at it, it is one of those things where it's behind us, right? It's one of those things where every organization is going to go through the natural evolutionary steps that they're going to face. And for us, it's a focus on the future. It's to say, hey, lessons learned, how do we do better? And for that, what Sarah Crevens, what Dr. Rishi Sukha has done, I'm fully bought in. And I think that, we're going to allow our actions to speak for us. And as you can see, you don't create a payer organization that really feels the unit cost and utilization if you're not really bought into that long-term value-based accountable strategy.
Yeah, and I'm curious. I want to circle back a little bit to what you were talking about in the transparency rule and the machine readable, and obviously not every consumer has that, as you referenced. We've also seen that the disparities between how health systems are putting out that information is so wide and varied. So, are there examples that you're hoping to take to market that say, here's a really solid way to put out transparent information so that the patient knows at the point of care what their liability may be?
Yes, so Sutter Health Aetna is actually partnering with a company to make all of this extremely accessible. And so that company has really been focused on going out to every single one of these websites, demystifying the data that's available, and then also calling out the organizations that have not posted those rates. We're also working with our broker partners as well. As you can imagine, the brokers, producers, consultants in this field are also ravaging after that data. And so we're finding that there's some unique partnerships now forming between payers and brokers or consultants in ways of, again, opening up this war chest of data and then making it actionable for employers.
How big a part of that puzzle is the broker piece? We don't talk about them all that often, but how big of a piece is that?
I think they're massive. I have a lot of respect for the broker because they're making sense of all the chaos that's been created within, our sector. And I think they're going to play an increasingly important role as these organizations are now shifting to different employment models and these hybrid approaches. And the fact is that these brokers have been along for the ride. They know where we're coming from. They're not these net new players in the system. And they also know where we need to be. And they're fully aligned with the interest of the employer. So I love it. And the partnerships that we have, we created 2 producer advisory councils, one in the Bay Area and then one in Sacramento. And we meet quarterly. And I look for their direct feedback on everything from clinical programs to just how can we make this easier operationally for their clients and ours.
And so sticking with that, how do you evaluate who to bring into a partnership like that on the broker side?
Well, I think it's, easy when you can just look at like their market share, but then I love to find the brokers that might have a smaller market share, but they're innovative, they're new, they want to break some of those traditional rules. They're willing to point out the 800-pound gorilla in the room and the sacred animal over there. So we have a mix actually, which has been quite fun. And then you keep the term short, right? 1 year in and out. And we want lots of representation. And we are going to be highly transparent around those conversations and, from meeting minutes being shared with all brokers. I think it's important for us to treat everyone the same.
Got it. And Jeb, a couple of times you've referenced the employers and obviously the consumers. There must be a different strategy for whether you're going towards the employer market or the consumer market. So how do you, differentiate between the two when you're talking about some of these issues of transparency and making it understandable for everybody?
Yeah, I'd even go so far as to say we break down employers by segment. right? When you're talking to a small group, where the HR benefits person is also wearing 15 other hats versus talking to a national employer where they might have an entire division dedicated to benefits, you have to do a little bit of the homework for them. That's our job, right? Is to make this. We have to be the steward of the spend, right? We have to be the watchdog of the dollar on behalf of so many of these organizations. So for us, I'm going to change our tone and the amount of work that we do by segment of the employer. And then when you get down to the consumer level, I think we all know, there's a reason why payer literature is written between the 3rd and 5th grade reading level. We have to be able to make this not only palatable, but actionable, right? And when's the last time you read your EOB? That's a problem. The fact that, most people in our own organization might even raise their hand and say, I haven't read it in the last few years or never. That is a major, major issue, because so many of the things that we're creating are in the benefit structure. And if you don't understand the benefits, then you can't engage. And if you don't engage, then there's no change.
Right. And then you get that bill or whatever later on, and then you realize, oh, maybe I should have read the explanation of benefits to understand what was going on.
Right. It's incumbent on us to fix that too.
Right. Got it. So there are a couple of things I want to get at here before we close out. One is we've obviously got Sutter Health, Aetna. There is, a similar joint venture up in Minnesota. And you have an experience, as I said, at Highmark. So as you think about other organizations that may be looking at a similar type of joint venture, what are the 2 or 3 things that those leaders really need to consider before they go down this road?
Well, yeah. So first off, I'll just start with the baseline, which is, Sutter Health, Aetna. I came from an integrated delivery and financing system at Highmark. So I've seen the way it works. I've seen how Highmark partnered with other provider organizations in their local market and did tremendous things in terms of creative value. And so from my perspective, what we're looking to build here is a virtually integrated delivery, retail, and financing system. Because what we're going to bring in is not only the integrated delivery network of Sutter, but we also, within our performance network, have Stanford and Brown and Toland. We have CVS, right, where 80% of Americans live within a few minutes drive of a CVS location. So we've got to bring that into the value equation. And then finally, the payer arm of the house. And so as I look out in the industry and continue to field questions on LinkedIn and email of people saying, hey, we're thinking about this Payvider, Guidehouse just put out a wonderful article making a rallying cry essentially for more Payvider organizations. What I would say is this. If you're serious about value-based care, value-based reimbursement, this is essentially the epitome of that, especially in the fully insured market, where you'll see the provider side of the joint venture holding 50% responsibility for risk-based capital. So they really are putting their money where their mouth is when it comes to high-quality care that's also affordable. And then I think, on top of that, not just the marketability and being serious about value-based care, but also I think that the strategy is important. You cannot be half pregnant, right? You cannot say, oh, we're going to have partial FTEs assigned to this. You have to have a dedicated team that's going to see it through. The best analogy I can give you is when, 2 companies are merging, how often do we hear, there's aligned synergies, right?
Right.
Well, actually seeing that through and making that happen is very difficult. And I think the final part that I'd call out is when you bring together a payer and provider, those are conversely related income streams. And you have to understand that might sound great. If you're coming out with your MBA and you're saying, wow, that checks the box. Think about a clinical service line leader who has P&L responsibility, who is going to see 5% decrease in the emergency department due to us on the payer side going after avoidable utilization, or 10% decrease in the orthopedic service line for reduction in lower back pain surgeries. In my mind, I think that you have to have both sides and make sure that P&L leader and that payer leader are talking and have a unified goal, because that demand destruction that occurs is very real. And the pop health wonk in me loves it. But then the P&L side and the global kind of responsibility also realizes that's something you need to plan for, because it is a very real thing.
Right. And I imagine make sure they're talking somewhat the same language too. We could talk about this. I could talk about this Payvider area for quite a while, but I did want to, in the last couple minutes we have here, Jeb, I did want to pivot a little bit to, what we're seeing out of the pandemic, which is more of the shift to providing some care at home. And I know one of the things you guys have recently launched, I believe, is physical therapy at home, if I've got that right. Can you talk about what you think that transition to more care at home is going to look like for the payer provider community? And maybe you could talk a little bit about what you're doing with that PT at home, which seems like a unique model.
Yeah, no, for sure. And you're completely right. We're seeing the adaptation of at-home services like never before. And it's not just our PT at home. We also launched a virtual first primary care offering through Sutter Health's Terra practice, which is incredible, right? And we've made some minor adjustments too that differentiate this from most virtual first primary care offerings, such as making sure the same clinical team that you're dealing with virtually, you deal with in an in-person instance as well. And then we even have like a behavioral health navigation program. I don't think the world needs another point solution in the mental health, behavioral health space, but navigating that with an actual warm body, not a chat bot, but somebody to answer the phone and talk to you, those things have proven valuable. I think anytime you go into a service line and you see an increase in utilization, it is very important that the payer is vigilant and unapologetic in terms of ensuring that the value that is created can be justified with the expense. The amount of false alarms that can come off from remote patient monitoring, the amount of missed preventative screenings. Think about a patient walking in for a visit. You're going to see their gait. You might not get that if we just engage like this and we're just sitting here. So there's some things that you really have to think through. And the at-home physical therapy, the most important piece for us on that was it was really where is the best physical therapy happens in your home. It's when you can use your step or your chair or your desk in different ways. You can use your books and weights, and you're not waiting for that one visit every 2 days, and you can actually take control. So we have found that not only does the member enjoy the fact that they don't have to go anywhere and that we're bringing the services to them, but that we're also making this foolproof, right? We're looking at their surroundings. And I think the last piece that I'd call out is we finally bridged the gap in terms of getting into those social determinants of health, right? We're finally seeing the 80 to 90% of the causal factors that are bringing the patient into our hospital in the first place. So no wonder why their nutritional plan never worked. Their refrigerator doesn't exist, right? No wonder why they're having these issues with their joints. They live in a townhome and they're 80 years old. So that type of information has been invaluable. And now the pressure is on us to actually make sense of it and then to act upon it. So I'm excited about the next year, but we're taking this very seriously, and it's a fun journey for everyone.
Yeah, I'm sure. And it sounds like we'd love to stay in touch as you start to get some data rolling on what this program looks like. So, Jeb, we definitely appreciate your time. We could go on for, as I said, quite a while on some of the stuff, but we try to keep these tight as we can. But again, we'd love to follow up, especially as some of the data and you start to get more and more into the role. We'd love to stay in touch.
I'd love to. Thanks, Matthew, for having me on today.
Thanks so much and take care. Now, I'm Matthew Weinstock with Modern Healthcare. Be sure to come back next Monday for another edition of The Checkup.